We are here on the Erectile Dysfunction Radio podcast, where we tackle the facts, debunk the myths, and provide real solutions to help you take control of your sexual health and confidence. I am Mark Goldberg, certified sex therapist and host. For any men who are serious about resolving ED or other sexual challenges, we encourage you to visit our website, eiqmen.com, and use our additional resources, reach out to us with questions, or schedule a 15-minute complimentary call with myself or one of my team members. We are passionate about helping men like you, so please do not hesitate to reach out to us. Today we are joined by Dr. Elliot Justin. Dr. Justin is an emergency medical specialist, and he is the founder of the company FirmTech, right, that specializes in biofeedback devices, specifically in the sexual health realm. He's joining us today to discuss how ED medications have changed the way we diagnose and treat erectile dysfunction. Dr. Justin, thank you very much for being with us.
It's a pleasure.
All that being said, so can I ask you just to give our listeners a quick overview? We've had you on the podcast before, but if you could just remind our listeners to share with them just a little bit about yourself and what it is that you do in the medical realm and with the company.
Sure. Well, by background, I am an emergency medicine doctor. Many years ago, I founded a company called SwiftMD that is the second oldest telehealth company in the United States after Teladoc. And that company got me interested in remote patient management technologies. What can people learn about themselves at home without the secondary gain? Unfortunately, that motivates a lot of insurance company issues and motivates a lot of what physicians do for people. So about 3 years ago, I was contacted by a urologist at the University of Utah, Dr. James Hotaling, who asked me to come up with a way of counting the number of nocturnal erections that men have because they're a leading indicator of their cardiovascular health. And that was news to me. You know, we all know about morning wood, and none of us want to have dead wood. But we all, the fact that there's a correlation between the number of nocturnals and a cardiovascular health is profoundly interesting to me. Because it would be like another vital sign, and one that's a lot more motivating to men than their respiratory rate or their blood pressure. So he like most straight urologists, is a cock ring virgin. I'm not. I'm fortunate to be married to someone who enjoys sex toys. By the way, if any of your listeners are considering getting married, I recommend that they find out about whether their partner is interested in sex toys, because that should be on every guy's checklist of desirable qualities. Anyway, that said, for me, cock rings were these hard silicone, uncomfortable plastic rings that they've manufactured the same way for the last 150 years. They've never really caught on. So we also, in order to come up with a way of counting the number of nocturnal erections overnight, we have to also solve the cock ring problem and develop a cock ring that is safe and effective for the problem that actually is the number one cause of most men's erectile dysfunction, which is actually, I call it fading erections. The urologists call it venous leak. And that I wasn't expecting, nor were the urologists. So our device, the tech ring, one overnight, it counts the number of nocturnal erections, how hard they are, how long they last. And I will say we have had two men that I'm aware of get cardiac catheterizations as a result of getting this data, because one of them had no nocturnal erections, and the other guy watched his number go from 3 to 2 to 1, and then that alerted him that he probably had a significant cardiovascular problem. But the device, I don't know, Mark, how long ago you and I first spoke? It was about 2 years ago you and I spoke? Was it a year ago?
About that, yeah.
Yeah, about that. We now have documented 60,000 erections. We have the largest database in the world. And researchers are now starting to mine that data for information, and so the anticipation of urologists and cardiologists was that as the incidence of erectile dysfunction goes up 10% per decade after age 40, that as that goes up, if you will, illustrated in my hands, the number of nocturnal erections would go down, and the firmness of sex erections would go down for most men. And that's not the case. And it's really interesting because one of the things that we do as doctors is we often see a problem, a severe problem in our practices, and then we generalize from that. So it is certainly true that men with significant cardiovascular disease, men who have angina, heart attacks, stroke, men who are taking men who have severe diabetic metabolic syndrome, these men have both pump issues, and arterial insufficiency issues that lead to less blood going to their penis. And we can diagnose this assess that, diagnose by tracking their nocturnal erections. But that's not the situation with most men. Most men, even as they get older, if they develop high blood pressure or borderline diabetes, they still remain relatively healthy, and it does not have an impact on their nocturnal erections. So that's revolutionary, because the doctors were not anticipating this. Nor does it have an impact on the hardness of the sex erections.
For too long, men have been told that pills, supplements, and devices are the only way to manage and resolve erectile dysfunction. If you are one of the millions of men who know that their sexual function and overall experience is not just physical, EIQ is here for you. Our one-of-a-kind, self-guided e-course is designed to empower you to jumpstart your process of addressing performance anxiety, building confidence, and enjoying sex again. No gimmicks, no pills, just real solutions for men who want them. Try our course today at erectioniq.com.
Okay, so it's really, really earth-shattering data for people in our circles, but also, it's really important for men to understand that, because I think that I'll just emphasize this for our listeners. I think there's a tremendous application for this device that you have developed for any man who's experiencing erectile dysfunction and isn't sure, where is it stemming from? Can I get an erection at all? Because a lot of times when men are intentionally trying to get an erection and they can't, they've concluded that they must have some major, cardiovascular blood flow issue going on. And it sounds like, Dr. Justin, that the data that you have been able to collect and aggregate is indicating that men seem to have healthy erections, long beyond that 40 mark, even when there are some health issues present.
That's correct. So, one of the things it's a mistake to my mind. Often in studies, they group together men with two different problems. So I look at ED. It was interesting because I come at this field fresh, because I'm an emergency medicine physician. And so there are two groups. There are men who can't attain an erection. Well, that man is not getting blood into his penis. That man has a significant cardiovascular or neurologic problem. That man needs to see a urologist and a cardiologist and get that assessed. But most men, the majority of men, and that's probably about 10, 15%, the majority of men who have ED get an erection and lose it. And the question is why they lose it. And that can range from psychosocial issues, medications, a combination of diseases, men who are borderline diabetic, men who are hypertensive, alcohol, recreational drugs, and other things that can have an impact on that. So it's really, if a man gets an erection and loses it, also the number one drug that's prescribed is not going to be all that effective, because the PD5 medications, and the brand names being Viagra and Cialis, or sildenafil, tadalafil being the number one medications, they can potentially put a bit more blood into the penis, but they don't keep it there.
Yeah, so I want to come talk about the PDE5 inhibitors, sure, that whole world, in a couple moments. But just kind of sticking with this device that you've developed. So you mentioned that there could be, again, a number of other factors like psychosocial. So I think for a lot of our listeners, many of them do have medical issues that are contributing. There is a profound interest among our listener base with the role of the mind in the erection process, both in facilitating but also being a hindrance to erections. Do you see in the data, and would you say that this device could be helpful for men who are wondering have suspicion to believe that they have a psychogenic or a psychologically driven erection issue? Would this device help to give some data or feedback about the actual physiological state of erections?
Feedback and also potentially therapy. So if a man gets the tech ring and finds out that he has 3 or more nocturnal erections per night, but has difficulties just sustaining erection, that man has a psychosocial. It's more likely than not to have a psychosocial issue. It can be aggravated by medications, the beta blockers, the ARBs, the SRI antidepressants that doctors prescribe without consideration of patient's sexual health. They can have an impact as well too. But if the man has nocturnal erections, and the 2 plus to 3 in number, and if his nocturnal erections are 6 to plus, beyond a 110 scale in firmness, that man, all things being equal, should be able to have sex. So if that man then tries to have sex and gets an erection, this is the therapeutic part, the erection ring prevents will start to block the confidence issues, the anxiety issues that man has with performance, because as blood leaves the penis, the erection ring holds the blood in the penis and sustains the
And helps to
erection.
maintain it. Yeah.
And that's it. Go
Yeah.
ahead.
We definitely want to leave a link and access to like men who want to find this device, because I would say that if any person is on the fence and they're not sure, do they want to like try to address this from a psychological standpoint, like this may be a worthwhile investment. Like it may be worthwhile to be able to mine your own data, like to be able to know what's going on, and to get something which is more definitive. It's very difficult to know outside of the stamp test, which is the old way that this was done, right? But that is not exact data, because you don't know if it was 1, 2, 5. You don't know how many erections you had. All you know is that the stamp chain broke. But this would give you like real clear data about the quality of erection, blood flow, etc. It can really put a man's mind at rest or at ease, like to know at least directionally where should I be going with this if I'm trying to get to the bottom of the erection challenges.
Yeah, another thing that talk about psychosocial issues are we like to talk about the importance of communication in a partnership or marriage. But there are certain things that I've learned from speaking to patients and customers that made me realize that there are certain things issues that men have with their partners, that could be female or male, that they don't want to discuss, and they actually can be destructive. And the ring can help with those things. And I'll mention them. I'll mention the first one: friction. Is a man getting enough friction when he penetrates? So if his partner's had a lot of kids, he ain't gonna get that friction. I mean, I don't, and a ring, once a man gets hard, the ring can compensate for a lack of friction. The other is boredom. In a long-term relationship, certain positions that might be still attractive to their partner, missionary position or rear entry, they can become boring, and men that can lead to anxiety, a loss of confidence on the part of man. And the third one is distraction. Many women, my wife is actually one of them, as are our two sisters, in the middle of sex, they'll start talking about something else that they got to get off their mind, even though they're turned on. Something went on with the kids, something went on at work, something else. Well, previously for me, that would have been a what the fuck moment. I'll pick on myself for a moment just to illustrate this. Then I'll talk about a patient of mine. When I came up with the ring, which was like 2 years ago, February, I was having sex with my wife, and she started talking about how the garage door was open and it was snowing. Now, ordinarily, being a guy, that would have been what the fuck, can hold that thought to yourself for for like 5 minutes. Well, I went downstairs, closed the garage door, actually ended up bringing her a cocktail as well too. In the past, I would have been so angry, irritated rather, that I would have been like, hey, we're not fucking tonight, it's over. But because I had the ring on, I'm hard. And a guy with a hard on thinks differently. A guy doesn't have a hard on. But let me illustrate that with a customer / patient, if you will. This guy spent $16,000 on trying to solve his erectile dysfunction. On the conventional side, he has seen 2 world-renowned urologists. He's had shockwave therapy. He's had red light therapy. He's had PRP injections, shockwave therapy, taking tenosyls every day, and he still is losing his erections. So I asked him a question, because the doctor never asked him this question. I said, when do you lose your erection? This typical story. Well, he gets hard with his wife, goes down on her, loses erection, and then she wants him to penetrate, and he loses erection again. She's had 5 kids. He doesn't feel anything. He bought our non-tech ring, which is our maximum performance ring, which is basically a very effective cock ring, and he was able to have penetrative sex and to have a climax. And his response to me was, "I spent $16,000. I could have fixed my problem with $60, because the problem was, I didn't want to tell my wife that her pussy's too loose." Well, no guy wants to tell his wife. That's kind of, I don't know about Mark, your marriage situation, but that would kind of be a buzzkill to your wife, and to say, "Hey, I don't, I'm not turned on by this."
Yeah, these are conversations that I think require a tremendous amount of vulnerability. I don't necessarily discourage them, but I also understand that the vast majority of people are not going to have those conversations. Right. And if there is a way to resolve this, I'm fully supportive of doing that. Now, of course, like I would encourage that any guy who's going to use a ring, you probably should inform your partner of it, because they will notice it, feel it,
Yeah.
sense it, and are going to ask questions anyways. But there are ways to be tactful about how to communicate this that don't have to be critical of a partner, especially with something that, for a heterosexual couple, if she has no control over the elasticity of her vaginal canal, we don't need to go there necessarily.
Right.
Right? All that being said, I mean, I think that mentions be aware there are a lot of rings on, like, the market. This has been designed by Dr. Justin, and one of those rings, if not maybe a couple different models, do have the data collection
Correct. The
aspect
check
to it, which I
ring.
think really makes it very unique. And I do believe, again, from a psychological standpoint, there's a tremendous amount of value in biofeedback. Outside of just knowing, there's a certain sense of relief that people can go back to that data and see, like, either it's working or it's not. You can really get, like, concrete information. That's why I would encourage, like, if you're going to make an investment into this process, this is certainly a tool that you want to consider in your arsenal. All that being said, I want to pivot over, Dr. Justin, and I
Sure.
want to talk a little bit about PDE5 inhibitors and get your take on that. So, can you give our listeners just, like, a brief history of, like, ED treatment, like, right up to, like, but right before PDE5 inhibitors came on the market, and how the introduction of these has changed the way we conceptualize diagnostics and treatment?
Well, before there was really nothing. so of any substance. So I mark I'm quite a bit old. I can go back to the 90s when the PD5 inhibitors came out. They were so enormously popular. I was working in the ER at that time that we actually, and at that time, the only people who could prescribe them, they're restricted, were urologists. We kind of had guys that come to the ER like 2 o'clock in the morning, looking for a pill because they had a problem. I mean, there are a few emergencies short of a heart attack or a stroke that alert a guy, like other than a limp dick. That said, let's look at the original. Let's look at the original Pfizer sildenafil application to the FDA. As I recall, off the top of my head, there were like 7 papers. In 2 of those papers, there was no more benefit other than placebo. Well, that's not particularly impressive. In the paper that had the most benefit, which was 70% of the men benefited, those are men who had prostate surgery. Well, that's not the situation of most men. So now there were 4 other papers varying in benefit between 10% and 20%. That's not a powerful medication, and that actually goes along with what our data is showing, that the benefit of the PD5 medications is they pull a little more blood in, but that's not most men's major problem. Also, the benefit was being tracked, measured using subjective scoring systems, which are, to get technical, the IIEF and the ADAM and the SHIM. Well, they're subjective. I want to take men's healthcare into the objective world. So the data that comes from our tech ring is objective, actionable, and most important, personal. It's your data. It's not generalizable data. So right now, if a man goes to a urologist or his GP and internist and says he has a sexual problem, they'll tell him, "Oh, I'll take 5 of Cialis," and they'll come back 3 months later, not working, take 10 of Cialis. Well, that's not a very, very scientific approach to erectile dysfunction. That's not how we treat blood pressure or cardiac arrhythmias. We get multiple blood pressure readings and multiple electrocardiogram readings. So I'm unimpressed by the PD5 medications overall, because our device, men can actually, like with a blood pressure cuff, they can say, "Okay, I'm taking 5 of Cialis. Is there any real objective difference? Not placebo psychological difference." And by the way, I recognize the placebo effect is powerful, but is there anything objective going on? I know for myself with Cialis, there's no difference between 5, 10, and 20, other than the 20 gives me a headache. With my device, I can measure the firmness of my erections and how long they last with the device. And there are 2 papers, one we did internally and one that's independent, looking at detumescence. So detumescence is the time it takes from erection to go down after a climax or after maximum erection. With nothing, it was about 35 seconds. With 10 milligrams of tadalafil, it was a little bit over 2 minutes. With a ring alone, it was a little bit over 2 minutes. And with both together, it was over 4 minutes. And the takeaway for men for that research is, if you want to maximize your performance, put a ring on it, and take a pill. Combination therapy is the most effective because
Yeah, so
men.
there's no question that a lot of the combination therapies, whether even with like the psychological therapy and the medication, the rings and whatnot, it will deliver better objective results. That part is for sure true. A lot of men will shy away from anything that they cannot sneak past a partner, and I know that, and I think you know that too.
Yeah.
Which I think is a lot of where the appeal for the medication comes from. Now, going back to the statistics that you said, like I'm not, I don't have those papers in front of me. I don't know, but I do know that there is a high rate of satisfaction. I did hear you mention placebo, and I'm getting the impression. I don't want to be presumptive, but I'm getting the impression that you look at some of the efficacy, maybe a fair or an outweighted portion of the efficacy, as coming as a placebo, much more than it is actually like getting more blood into the
Yes.
penis.
Yes. But now, again, if a man has significant vasculogenic disease, then the PD-5 medications are beneficial. But if a man doesn't have vasculogenic disease, then the benefit is largely placebo. Let me draw an analogy to what we're seeing with shockwave therapy, if you don't mind.
Mm-hmm.
Because our device, right now, if a man goes to a doctor who does, urologist usually does shockwave therapy, and says, "Gee, my dick isn't what it was 20 years ago," they'll shock him. What we're seeing though, we have men who are buying our device before they start shockwave therapy. If a man has only one nocturnal erection, no nocturnal erections, or maybe two weak ones, his vasculogenic disease is so advanced that shockwave therapy is not going to benefit. At the other end, if a man is having three or more nocturnal erections and gets
Probably doesn't
shockwave
need it.
therapy, the benefit is placebo. And we have men men I've spoken to who acknowledge that they're having three or four nocturnal erections, but the shockwave therapy.
Yep. So to that end, I mean, I would, like, if it's okay with you, I would call it having a. I know you're calling it placebo, but I wonder about, like, if there isn't something more nuanced that's happening with some of these men, because I realize that a lot of men do have like an underlying performance anxiety, because a lot of these men that are taking PD5 inhibitors actually can get erections on their own. They're struggling with a partner. Like, there's a lot of very particular and nuanced pieces, but I do wonder if there is something maybe a little bit beyond a placebo, which is that there is a physiological sensation that a lot of these men describe, right? Which could be a confidence booster, which could get the mind like thinking in a direction which is much more, let's say, pro pleasure and less anxious, just by like what they feel from that enhanced blood flow. So, like, I do wonder if it goes a little bit maybe beyond placebo, and that there is, again, some type of combo effect, that a man doesn't necessarily need this to get an erection from a physiological standpoint, but it does
Yes.
help like the mind kind of get in the right direction just by having that initial confidence.
I do, and that's a good point you make, and I do want to somewhat modify what I said, because there is clearly, even in healthy men, a benefit from taking a PD5 medication, in that it will prolong your erection on the basis of the two detumescent studies that we did. PD5 medication alone will put more blood into the
Mm-hmm.
penis, but in terms of keeping it there, you, you know the ring is the ring is actually an objective benefit, and I wish that men and the partners were open-minded about rings. And I actually think that part of the issue here is with the men rather than the women. Let's look at vibrators, Mark. I mean, you're much younger than me, and when I was dating back in the 80s, there was a certain shame associated with a woman using a vibrator. You got to come with penetrative sex. The vibrator is addicting. The same type of stuff we hear about men in pornography today. Oh, it's addicting. You got to, and then it became normal over time. So there's no shame with most women, in most cultures, even, well, not all cultures, but in many cultures, there's a little shame with using a vibrator. And men, they still have a certain association of cock rings with gay sex or fetish sex, and it's time for men to move beyond that. From talking from the couples that we have women buying our rings. We have women buying our rings for two reasons. One, women are more concerned about health than men are. They buy the rings to their men because they're concerned that their man is not functioning sexually, and they want to know, is that me?
They want to help out.
Is there a disease? They want to help them. But what's going on here? But we have women who advocate now for rings because they've seen the benefit in their confidence that their men have. Their men are no longer worried about losing their erections because they're using a ring that's comfortable.
Yeah, so I think you raise a fair point. Where anecdotally, I think I can say that for people, let's say, who are in a new relationship, dating, hooking up, whatever it might be, the notion that a female partner will pull out a vibrator, I think, is far more accepted than a male partner will pull out a ring.
Yes,
I think that part is true. I do think that part is definitely true, and there certainly is a stigma around this, and there are solutions that men would prefer, like slipping a pill when their date goes to the bathroom, right? Because it's just something that can't be perceived. So I'm sure you've encountered, and many of the urologists I'm sure that you work with encounter that the guys just don't tell their partners that they're taking a PD-5 inhibitor.
They lie about it.
They lie about it, right? They lie about it, or they don't disclose that information, and which is income. So coming back to like the PD-5 inhibitor world, do you think that the availability of these medications has led more people to seek treatment for erectile dysfunction? And with that, like, has that made some doctors and patients, let's say, less curious or less open to investigating like the actual causes and drivers, because it does seem to have, whether placebo or physiological or a combination of the two, it does seem to have a pretty strong effect for a lot of men?
I don't know whether I'd say it has a pretty strong effect for a lot of men. That's physiological as opposed to psychological. But it definitely, on the other side,
it works, whatever the mechanism is.
Right. It can mask problems as well too. So one of my concerns with how readily available PD-5 medications are is it's one thing for a guy who's 30 to go online because he's dating and has trouble getting it up with new women. It's another for a guy who's 55 to do that because that guy may well have a cardiovascular or urological problem, and the pill can, for a period of time, potentially mask that. So I'll refer to the two men that I'm aware of who got cardiac catheterizations utilizing our technology. They were taking PD-5 medications, and for a while, they were blaming, actually, since the pills weren't working. And the pills weren't working because the cardiovascular disease was so bad. But since the pills weren't working, they were blaming their partner. You're boring. You turn me off. You're too fat. And that's so. There is. I think there is risk. Not that I'm saying they should be banned, but there is risk, and men should be thinking that, hey, if I'm over 45, 50, or if I have heart disease or a family history of heart disease, I probably should get data. I probably should know what's going on with my nocturnal erections before I just take a pill.
Yeah, and we recently did an episode on some of the direct-to-consumer platforms, and like this exact issue also came up. That it may be a great immediate patch option for some people, but the downside to both these platforms and the PD-5 inhibitors is that they don't really get to the heart of the matter. There's just no way to do that using these medications and using these platforms, and that is definitely like one of the downsides. And it sounds like you're seeing that as well with these medications. And I heard you mention somebody goes online and gets these pills, which seems to be the primary way that these pills are being obtained now.
Yes,
it's like a quick telehealth visit and a prescription at your door.
Yeah, I mean, an interesting group of men, it's a large group of men, are men who can get rock hard when they're masturbating, and then they get hard and then they lose it with their partners, and they were looking for the pill as a solution to that. But those men don't have arterial insufficiency. Now, the pill might help a bit, help them keep hard a little bit longer with their partners. They're still going to lose it, though. And that's where combined therapy is more valuable. But then, what's been, Mark, another thing that's been really interesting is the degree of distrust that I hear from our customers, distrust of other doctors, because the doctors don't ask them about what's going on in the bedroom. The doctors just prescribe pills and doctors don't warn them about the sexual side effects of other medications, antihypertensives, antidepressants that they're taking. The doctors are really we're doing a bad job of taking care of people.
Yeah, so I've heard from multiple doctors over the years, and I think we're getting better at this, but not outside of the urology space. So there is a discomfort in asking some of those questions. So if like a guy hints at it, it's a lot easier just to write a prescription for Viagra and say, "Hey, let me know if this works," than it is to kind of like dig into the details. And I think that is part of just being human and feeling that discomfort, and we certainly have not broken down all of the stigma, and that is a challenge I think that remains. But it kind of goes back to, again, part of this is that like Viagra is a effective band-aid for many people, but I think it does catch up with almost everybody over the course of time.
Yeah, I agree with that. I think it's part of the issue problem is cultural, but part of it is just the healthcare system. I mean, there's a big study showing the average urologist spends actually 7 minutes with a patient, where there really isn't even time to get into sexual history. And also, there's not I don't know whether you've worked with electronic health records like Epic or Allscripts, which are the big ones. There are no questions. Doctors aren't being prompted to ask any questions. I mean, Mark, if you or I went to a doctor and said we had chest pain, you'll get 15 questions that'll pop up. And if you don't answer the questions, the computer basically tells her, "Hey, Elliot, idiot, you didn't rule out peptic ulcer disease. Hey, Elliot, idiot, you didn't rule out dissecting aortic aneurysm." When it comes to someone's sexual health, there are no questions. And that's wrong. And I'm actually starting to try to work with Epic to get that changed. I probably will fail, but we want to get those questions into the electronic health record.
Yeah, I mean, I think that could be, again, like a impactful thing, and really, I think one of my takeaways from the episode that we did about direct to consumer, and also I think what you're sharing, is that at the end of the day, the way things stand currently is that patients have to be their own advocates and have to decide how they want to approach this. If you want a Band-Aid solution, it's available to you. It really is like a couple clicks away, and it'll be at your doorstep. And if you want to get to the bottom of this, like, you need to be the one right now that's advocating for that. You need to find that doctor. You need to be able to speak with your doctor. You need to bring this forward. You need to be interested in getting to the bottom of this and advocating for that with the health system.
Let's just compare ED to high blood pressure for a moment. There's no way that I could go online and have someone prescribe me high blood pressure medications with a questionnaire. There's no way I could go, and now there's no way I go to a doctor and tell them, I get kind of flushed when I work out, and the doctor would say, "Hey, you got high blood pressure. Take this pill and come back in 3 months." But that's where we are with what you're describing as a Band-Aid, and it's wrong. And I think that anyone who's older, 40, 50 years or older, who's thinking about going online to get pills, they should want to know what their date is. And one thing with the tech ring, you can actually figure out what the right dose is. Is there a difference? Again, I'll get back to myself. For me, there's no difference between 5, 10, and 20 tadalafil. But if I were dealing with an online provider, they would quickly escalate the dose. If I told them, "No, I'm not seeing the benefit that I want," or so we're really going. I think we doctors are doing disservice to people, because we now have the ability to give people data-driven care as opposed to questionnaire-driven care.
Yeah, and I think it's a really important point I really think for our listeners just to think about. And again, I anybody who feels like they just want a Band-Aid, like that the system is open for that at the moment. Like, that is certainly how things work. It's available to you, and I wouldn't critique anybody who's looking for that quick fix. But I would say that if you are serious about getting to the bottom of this, you need to be aware that some of the things that are available are really just Band-Aids. Like, they're not really geared towards like helping you better understand, your body, better understand your health, and they're not really setting you up for the next bunch of years. If you really get to the bottom of your data, you may be able to get a real clear picture of what you're up against, what the best ways are to face that, and you're just simply not going to get that with a PDE5 inhibitor. And it sounds like, if I could just kind of bring this back to our primary topic, is that with these pills coming onto the market, a lot of the deeper dive into what is causing the erectile dysfunction has kind of gone missing. Like we're just not nearly
Yes.
as curious anymore. People are not asking those questions. It's just a quick script for a pill, and we've kind of lost a lot of the, I wouldn't call it just an art, but even like the science. Now we know how to do it, but the demand for that just has not kept up with the advent of these, again, quick fix solution based approaches to erectile dysfunction.
We're all on the road from erectile fitness to erectile dysfunction. We all would like to stop going down that road, ideally make a U-turn, but we're lost. It's like driving a car without a dashboard, and trying to, you just, and so that's or trying to get somewhere without a GPS. Data is just. We need to take men's sexual health into the 21st century of data driven care. I couldn't agree with you more.
Yeah, I think it's just a really powerful message. I think it's a good message to wrap up on. So for any of our listeners who are like in some process of really trying to get to the bottom of this, looking for like a way to better understand themselves, their bodies, what's going on, definitely want you to check out Dr. Justin's company, the devices that they have, and in particular the data collection devices, which, if I understand correctly, you get your own readout, you get your own biofeedback. It's information
Correct.
that you can use, bring back to your healthcare provider, or implement things based on that on your own. So we will leave a link in the show notes to the website and to the recommended devices, and encourage anybody who's serious about this should consider this as part of their more comprehensive approach to managing and facilitating better erections for the long haul.
The database now is so large that men can now compare themselves to an average man, the average of a man their age, or they can compare themselves to the best in in their age.
So I'll just say, we don't want to induce any performance anxiety. So we don't need to compare and contrast. As long as things are working for you and in your relationship, we don't need to compare and contrast. But if you are wondering where you are from a health perspective in comparison to your age demographic, that information could be helpful. So Dr. Justin, once again, thank you so much for joining us. This is really, really helpful, and just kind of digging into just the complexity that goes into erectile dysfunction diagnostics, treatment, and management. So again, we appreciate
Mark, thanks for the opportunity. Thank you.
Of course.